From Montana's news leader, this is the MTN 9 o'clock news.
Good evening and thanks for joining us tonight. I'm Russ Riesinger. Another day and another spike in COVID-19 cases as Montana saw more than 1,200 new cases and 20 additional deaths. The most deaths are out of Cascade County, where health authorities reported 9 victims today. Gallatin County reports 3 additional victims, and here in Yellowstone County, 2 more. 114 Yellowstone County residents have died from COVID-19 related illness, as the statewide death toll has now reached 644. More than 40,000 people have recovered from the virus. More than 100 traveling nurses and respiratory therapists have arrived in Montana to help fill critical staffing shortages at Montana hospitals, and many more are now on the way. Governor Steve Bullock announced today that the state is working with a Seattle area firm to bring the badly needed personnel into Montana. 110 medical staffers arrived through last weekend. Another 170 are expected here by the end of the week. Most of the help is focused in our big hospitals in Billings, Kalispell, and Great Falls, but they're also going to hospitals in Missoula, Butte, Bozeman, and Livingston. The Montana National Guard also has activated 58 members to help with non-medical duties at 5 of the state's larger hospitals. Montana hospitals are facing critical staff shortages right now. Many staffers have had to quarantine and can't work, either because of contracting COVID-19 or being in contact with those who have it. Governor Bullock's office says it expects that federal funds ultimately will pay the cost of the temporary medical staffing help. Well, here's a look at the breakdown. In Yellowstone County, the age range now with the most COVID-19 cases is from 20 to 39 years old. Between the dates of September 20th and November 8th, 20 to 39-year-olds consistently had the most new cases of any age group week to week. In the second week of November, this group made up 37% of the county's new cases. The next highest age range, 40 to 59-year-olds, at 27%. It's clear that cases are on the rise across the county. For the week of September 20th, Yellowstone County saw 366 new cases. 6 weeks later, for the week of November 8th, the county confirmed 1,064 cases. Well, with Thanksgiving coming up this week, it's usually filled with happiness, family, and food. But this year's holiday season also means more than 600 Montana families are missing and mourning the loss of a loved one due to COVID-19. As Q2's Victoria Hill reports, grief can be a helpless feeling, but one lame deer man is using that tragedy to help others.
My father, his name is Isidore Whitewolf. He was a vet. I was close to him. I didn't think nothing of it when he first told me. He said, "Son, if I get this COVID, I'm not going to make it." And I thought, oh, he's tough. He'd been through a couple of heart stent surgeries and he gets through with diabetes.
But Isidore would be right. A positive test on August 21st.
I remember him telling me that he was scared when he did get it.
He took his last breath 22 days later on September 11th. His family left to mourn.
We all felt the grief and the shock of, we didn't see any of this coming to us.
And they weren't alone.
There was a lot of loss. At the time that I was at the hospital, there was a lot of people from my home and my town that passed away at the same time.
Goldstein and his family live in Lame Deer on the Northern Cheyenne Reservation. His father's battle would be one of more than 30 lost on the reservation since the pandemic began.
And I was just feeling a lot of grief. And I didn't have a support group.
He turned to the internet, but a search didn't turn up any groups focused on lives lost to COVID-19.
So from there, I just thought, if it's either a couple of choices. Either I can wait around and see if someone does bring one up or does start something that would help us in our local areas, or I can start with myself.
And that's how the loss of loved ones to COVID-19 support group was born. Hosted every other Tuesday, Goldstein held his first Zoom session 2.5 weeks after his father's passing.
It was just about relating to each other, and not surprisingly, but we were all going through the the same things with how to do this.
And to be in a group with people who are going through the same thing or have experienced the same thing is very helpful.
Terry Steinbrink is a hospice chaplain and bereavement specialist at Riverstone Health.
They realize I'm not crazy, there's nothing wrong with me, this is part of the natural grief process. So it's really helpful for them to be able to share with people that understand what they're going through.
While all deaths are tragic, a loved one passing away during the pandemic can add another layer of grief due to restrictions brought on by COVID-19.
A lot of them weren't able to see their loved ones at the end, which has added to the grief. They weren't able to have funerals or had really small funerals. And they just don't have quite as much support because people aren't dropping by to visit with them.
And as deaths across Montana add up, it means one less family member at the table during holiday gatherings, or for some, more.
Thanksgiving and Christmas are two of the harder holidays because they're thought of as family holidays. And so when you've lost, someone in your family, one woman I talked to a few weeks ago lost 4 family members. I mean, that's going to really impact their holidays.
Although they might not be present physically, the grieving process is softened when you allow them to be present spiritually.
It's important to come up with some way to remember their loved one. And we've had people do that in different ways. Some of them have maybe planted something, a plant that will bloom around the holidays. Some people light a candle in memory. If the whole family is comfortable, sometimes they'll share memories of the loved one. But I think it's really important for them to include some sort of ritual or way to remember their loved one through the holidays, because it's really hard to just try to pretend like everything's okay when it's not.
As he makes progress toward closure, Goldstein is willing to make himself vulnerable in hopes of helping others.
I would just suggest people to make sure they reach out and not go through whatever traumas they're experiencing alone.
And this advice for anyone grieving this holiday season.
Be gentle with yourself. Do not have the same expectations of yourself through the holidays. Maybe simplify things. If you don't feel like going anywhere, that's okay. Just to really take care of yourself through the holidays.
In Billings, Victoria Hill, MTN News.
Well, running has played a part in Goldstein's journey to closure. On October 19th, he ran 26 miles, 1 mile for each member of the community that lost the battle against COVID-19. Now, if you're looking for resources and a local support group, details are listed in this story on ktvq.com. Well, there is hope that a COVID vaccine will be available soon, but a lot of questions about how the process will work once that happens. Today, the Montana Department of Health and Human Services announced a statewide team that will help communicate those answers. The state external COVID-19 vaccination plan coordination team, made up of Montana medical, tribal, government, and community leaders, will also give feedback as the process rolls out. But Montanans need to realize no matter what happens, it won't be an instant fix.
This first initial round of vaccine, once it becomes available next month, will be available on a limited basis to the frontline workers, the frontline healthcare workers, those at most risk for COVID, and things like that. And so for most Montanans, it won't be available until later on in 2021.
Well, the draft says the vaccine will be distributed in a 3-phase approach. Phase 1 within the first 2 months after it's available. This goes to targeted critical workforce. That includes essential responders and people at the highest risk. Phase 2 between 3 and 6 months, and that will be expanded dispensing. This is the second dosing for Phase 1 recipients and first dosing for other prioritized groups. And then there's Phase 3, that's 6 months and beyond. That will expand and normalize distribution and public dispensing. At this point, it's believed that there will be sufficient supply. Tomorrow will be the first Zoom call meeting with the new coordination team. A Billings man is behind bars tonight facing possible kidnapping and assault charges. 37-year-old Adam Wilson was arrested after officers were called to the Sure Stay Hotel shortly before 2:30 in the morning Sunday. That's where police say Wilson held a 56-year-old Billings woman against her will. Lieutenant Brandon Woolley says officers were able to de-escalate the situation, but no other details were released. Wilson is being held at the Yellowstone County Jail. And some sad news to pass along in Yellowstone County. Longtime Yellowstone County Justice of the Peace Pedro Hernandez has died. Hernandez's death was noted in a Facebook post this morning by the Yellowstone County Sheriff's Office. The post states, "Your impact in this community goes far and wide." Hernandez served as a judge for 42 years before he retired in November of 2017 at the age of 76. Well, everyone is dealing with the pandemic, but on top of that, some Bozeman families are still dealing with the effects from the Bridger fire that destroyed many homes. MTN's Andy Johnson has the story.
It's been a little over 2 months since the Bridger Foothills fire, and while it may be easy to forget things when they're not fresh in your mind, families are still rebuilding and dealing with the effects.
We need answers. We need help.
Cassie Johns and her family lived in Bridger Canyon for 5 generations. For anyone, it would be frustrating to lose property to a fire, but for them, the real challenge has been after the fire.
Unfortunate, we're still out of our house just because of the smoke damage that has occurred. Right now, we have taken down all the siding to get all the insulation out of the house.
But the biggest issue this and so many other families are facing is the lack of assistance that was first promised.
Insurance companies aren't giving any money out to people that they need to get supplies to build barns or fencing or anything to get everybody back on their feet. You know, you sign up with something in hopes that you will get their constant focus from beginning to end. And it's not like that at all.
And while those certain companies, local and national, aren't maintaining their promises, some are.
It's United Way. They had multiple donations come through, and they have been dispersing funds to all the families up here that's been helping them in lost wages.
In addition to community support.
It's brought Bridger Canyon together. Neighbors have come to aid, community has come to aid with not only donations, but help rebuilding all of our fences, barns, clearing out things that, we needed help getting out right away.
Moving forward, all this homeowner wants is promises fulfilled.
It's almost December, and the snow is going to start flying again, and the cold's going to come, So it's fulfilling those promises that you made and making sure that you follow through with them.
Despite the challenges that still face this community, they're determined to rebuild and stay strong together. Reporting in Bridger Canyon, Annie Johnson, MTN News.
At least 68 structures were lost and 11 were damaged in that fire. Still ahead on the MTN 9 o'clock news, a Butte couple overcomes COVID-19 but is now dealing with some scary after effects. That story in just a bit. But first, we're going to see how this Thanksgiving week is shaping up. Krista Rose is in next with your full 7-day forecast.